Good evening, everyone. I'm Dr. Akshay P. Jadhav, consultant pediatrician at Altius Hospital. Today is World Autism Day, and we are here right now to discuss the same with one of the key persons in India who has started a society called Fragile X Society, and it encompasses the vision to help families who have one of the child or one of the individuals who is affected with Fragile X syndrome. Let us invite the person who has been a pioneer in this over a decade, who has been helping such families in a very big way, Mrs. Shalini Kedia. She'll be joining us shortly, and the topic for today is primarily to know what is Fragile X syndrome, what is the meaning of autism spectrum disorder, which is the new understanding about autism. But today we call it as autism spectrum disorder, and it is a larger perspective, and we don't miss even the children who are having similar symptoms, so that we don't actually miss them earlier on. And Fragile X syndrome it's a syndromic entity which we will discuss as it has a genetic tendency, and by genetic tendency we mean it is an X-linked dominant gene which gets transferred primarily from maternal origin to children. So we would like to have that perspective and understanding about both of these in a detailed manner, which will be easy for most parents to understand and the doctors as well to join hands with us and to help understand this disorder and the differentiation between autism and this, and how we can support the people who are affected by this. Let us wait for Mrs. Shalini to join us.
So meanwhile, can I ask one question? Did you have any experience with a child who was having autism, and how was it? Can you explain it if you have any experience?
Yes. Thank you, Hannah, for the question. So, autism or autism spectrum encompasses many individual things. Now, what we see in autism spectrum primarily, it can be mentioned as a complex neurodevelopmental disorder. So, it is primarily, you can see the challenges which are there in such children or people will be primarily social interaction and communication. And what commonly we see is restricted and repetitive behaviors. And most commonly, the motor coordination is primarily intact. And it's only in the severe form wherein it is involved, or it is included in a larger syndromic perspective, wherein you will see other disorders or other parts of the syndrome in addition to the autism part itself. So there is definitely a possibility of overlap between today's topic of Fragile X syndrome and autism spectrum. The Fragile X syndrome is an X-linked disorder, and primarily it is due to the genetic. It's a genetic disorder with mutation of FMR1 gene on the X chromosome, and primarily there you can see one is intellectual disability, one is the language delay, the third part can be social anxiety, fourth can be hyperactivity and repetitive behaviors which are similar to autism spectrum in general.
Good evening.
Let us welcome Mrs. Shalini Kedia, who has been instrumental in propagating the idea about Fragile X syndrome and special children, and to help such families and children across India to have a better quality of life. Good evening, ma'am.
Thank you. Good evening. I think it's an amazing initiative by Altius Hospital for taking this up, especially on today where the world is talking about autism and autism awareness. Kudos for taking this effort and making an impact.
So let us begin our conversation with few of the main headlines of this topic. And as most of us are aware as of now, that the topic lies with the two entities. So one is the Fragile X syndrome and the other is autism spectrum disorder. And the day we chose for this is World Autism Day, because both have some correlation, similarities, and some differences as well. And how, as a society, as a medical fraternity, as the community, and as the from the Fragile X Society itself and such other societies, how we can contribute to the larger picture here. So let us start with the first question for you, ma'am. Can you just elaborate about key differences between Fragile X syndrome and autism spectrum disorders?
So the key differences are actually very simple, because even as a doctor, these are the things you would notice. Autism is a behavioral condition, and we all know that, right? Autism, there is no blood test available to confirm autism. It is basically your clinical diagnosis and behavioral diagnosis and watching the child over a period of time and whatever we know. Thirdly, autism cannot be tested prenatally. Now, these three differences are actually the key differences, and also the importance of why it is important to rule out Fragile X in a family or a child who has autism. When you understand that Fragile X syndrome is a genetically defined medical condition, it's not a behavioral condition, it's a medical condition which is confirmed with a blood test. Of course, the doctor will go through all the clinical assessments, the behavior, everything, and then the DNA is tested via a blood sample, and it is confirmed that the child has Fragile X syndrome. And thirdly, which is the most important aspect, is Fragile X syndrome can be tested prenatally. Now, this is so important, especially for families where they are looking to have a second child. When a child has autism, they don't have any clarity whether they can have another child. They have the fear, will the second child also have an impact? How do we, eliminate that fact, or how do we look into the risk factor? With Fragile X syndrome, you do a test, you come to know if the mother is a carrier, you can test the fetus till they are 12 weeks old, and it gives you a lot of clarity. So these are the three core differences between Fragile X and autism from a doctor's perspective and a clinical aspect. Besides this, also there are many smaller differences. For example, children with autism don't like to be social, but children with Fragile X syndrome are very social. They love being social, friendly, and want attention. Then children with autism, they will hesitate in making eye contact, not want to be a part of a picture. Children with Fragile X syndrome like to be a part of a picture. They're good with eye contact also. Children with autism not necessarily will have the physical features that children with Fragile X syndrome have. So these are the few differences which are very important to be talked about and understood.
And possibly about the motor coordination as well. I think autism spectrum, the minor forms and mild to moderate forms, they have probably a little better motor coordination compared to Fragile X.
They are quite similar, but the fine motor coordination is in the larger picture of things, it's a smaller concern when we talk about the differences, because it is more of a similarity rather than a difference. If we talk about the differences, to be able to make the right diagnosis, whether it is Fragile X related autism or it is only autism. Children with Fragile X have lax muscles and they have a very low muscle tone, which makes it even more challenging for their motor coordination. So in a way, yes, physiologically, you're right.
The next question, or maybe the next discussion point, can be like, how common is Fragile X syndrome in India?
All over the world, Fragile X syndrome, to make it easy, 1 in 5,000 children around the world are affected with Fragile X syndrome, and that of course includes India. There's no reason for the numbers to be different in India. So 1 in 5,000 children, and that means we are looking at least 4 lakh children in India having Fragile X syndrome.
Among these, how many do you feel actually might be closer to getting help, or how many of them are supported by a society and similar societies alike?
80% of these children are yet to receive an accurate diagnosis, which is very sad. A part of it is the lack of awareness on the condition, and a lot of it also contributes to the family's resistance. Like yesterday, we had this father call us from Jharkhand, and the doctor has requested him to do a Fragile X test 5 years ago, but he's not yet done it because he says a lot of his money is going into therapies and seeing doctors, etc. And he wasn't even very sure if he wants to make that kind of investment in doing one more blood test. So we do see, and at the same time, on the other hand, we see a lot of children coming in now who say that my son is 8 years old, and since the last 5 years, we've been living with a diagnosis of autism, but just recently he's got diagnosed with Fragile X. So please tell us, what else do we add to the treatment options, and what else is in store for them?
What would be the rough cost of diagnosis if it's a 12 weeks pregnant mother or even a child?
So for a child, it varies between 5 to 7,000. For a 12-week pregnant mother, I'm not very sure because it would include the cost of the process of amniocentesis and drawing the sample. That would be an additional cost. But usually testing a blood sample costs between 5 to 7,000. And we have a list on our website of all the places who do the test where they can easily go and do a test.
I can see the point for discussion can there be some early signs or the symptoms which parents need to be aware of, wherein they should consider the possibility of autism spectrum or Fragile X in the beginning of the child's life?
This works better for me. This is something I tell most families. Whenever you go to your doctor, your developmental pediatrician is going to give you a file, and at the back of the file or in between there is a list of milestones, at what age the child should achieve which milestone. All doctors do that. The family should track the milestones closely. If there is 1, 2 or 3 milestones where they see a consistent delay for a prolonged period of time, is when they need to talk to the doctor about it, bring it up to the doctor. I know there are many families who are very scared to do that, and I always encourage the families, you'd rather be safe than sorry. So, for example, if the child did not babble on time, is not trying to be social, is not trying to talk or communicate, that shows a consistent delay in communication. Or similarly, if there's been a delay in the time the child rolled over or sat or took the first steps, you must bring it to the notice of the doctor. It could be autism, it could be Fragile X, it could be a developmental delay, it could be something as small as a child just being delayed and needs a little external help for a short period of time. But the whole idea being is reach out for help. Don't be scared. The doctors are there to help you, and they will help you through this process.
What we normally do is we follow a Trivandrum developmental scale, and we will also check the head points or the headings like motor, sensory, language, speech. So in this, as you rightly mentioned, that we would have to focus, maybe because of less muscular tone and other things, maybe motor delay, maybe sitting with support or even starting to stand or maybe walk, which is delayed beyond 1.5 years, and maybe speech and language delay beyond 2.5 years. Would be probably the rough timeline where most of us might get the answer.
Right. the key lies in the family being able to tell you this, because as a doctor you're seeing the child for 15 minutes, you're not going to make out anything unless the family brings it up. And it's not necessary at every visit you're going to ask the mother, did he do this, did he do this, did he do this. So it's important for the family to keep a tact and come and tell the doctor that this is one area where I am finding a concern, is there anything to be worried about, and then you can take it from there.
Absolutely. And because, as you rightly mentioned, we may have anywhere between 15 minutes or 30 minutes with every child.
Right.
So always a possibility that the child has anxiety.
I cannot hear you. The last 3 seconds, I couldn't hear you. Could you repeat what you asked?
Yes. So, how fragility is affecting the basic learning and behavioral part in children, and which we have discussed most of it, but how the educational support system or the societies and the specific societies which help such special children have a role in this.
So I think again here the most important part is understanding what does the condition come with. For example, if you take a child who comes under the autism spectrum disorder, which is a spectrum disorder, like the name suggests, children can be mild, moderate, severe. We need to, I think there's a little connection problem because the video is buffering. Am I clear to you?
Yes.
It is, okay. So I said that it depends upon the condition. Now, if a child comes under the autism spectrum disorder, we all know that they are visual learners. Children with Fragile X syndrome, we know, have a very high level of anxiety. So when a family approaches us with a child who has Fragile X syndrome, we actually handhold them through the whole process, explaining how the physiological change of that FMR protein missing is making a change in the brain and the way the brain perceives things and the brain's behavior, and how it is important to consider this when you're trying to teach your child something. So the lack of the FMR protein causes a very high level of anxiety in children with Fragile X. We need to accept it, acknowledge it, and deal with it. Of course, if the doctor thinks it's appropriate, the child might need medication for anxiety. The therapist teaches the child a lot of calming techniques and a lot of techniques of dealing with anxiety. And as a family, you make it a point to have an ambience, and rather than heightening their anxiety, using a lot of visual prompts, visual schedules, and visual supports is definitely the key for children with autism and Fragile X syndrome. That is a common thing.
Would music and audio visual cues also help?
There are like some calming sounds and a lot of sound therapy again. There are different kinds of therapies which truly help the child. In fact, I'd like to ask you, what is your experience? Children and nutritional supports or multivitamins are on board. I mean, are they happy giving the children those multivitamins and nutritional supports?
Parents are not aware that there is a possibility that their child can have deficiency. They feel that, okay, my child has appropriate weight and more than expected height, so maybe he's not deficient in anything. They need to do something. They Google a lot, but they're not aware of the possible deficiency. For example, now the most common deficiency I encounter in my practice is iron deficiency. Now, shockingly, India is anemic capital of the world among those which are in developing or developing to developed nations. And the number is staggering. It's like 60 to 70% of Indian children are deficient, which has to be addressed immediately. So every child who comes can be an iron deficient child. And then the next question arises, okay, how much is deficiency? How much is acceptable deficiency? And how are we going to use nutritional methods? Only when we tell them, they accept it. 60 to 70% of parents they follow and they continue the medications only when they are told why it is being given. And then apart from that, vitamin B12 and folic acid, which is essential for Fragile X and autism spectrum. The commonest iron medication which we have has all the three. Prescribing at the right time will help at least 50% of these kids, wherein parents might follow and continue the medication. What I feel is that this is necessary for the child is the first most important thing. And the second important deficiency is vitamin D deficiency. Now, most Indian parents might think that, okay, going outside in the sun might help their child to, replenish or help the first step of vitamin. Vegetarian parents, they understand, they feel that that's enough to help for the vitamin D. One of the studies which I did during my MD, we found out that even this deficiency is 90 to 94% in South India. So across India, definitely it has to be above 80%. It's important that we must check it at least every 6 months to 1 year, because most of the liver metabolism, even the metabolism which happens because of the medications or the changes in the liver which happens, are affected because of deficiency of vitamin D. So we need to make sure that vitamin D, iron, vitamin B12, folic acid, and many such common with multivitamins have to be supplemented at the right time for these kids.
This is a concern I have also seen, and that's why I asked you this question. Because out of all the other help we give, I have seen a lot of resistance in families to give their children medications. But I think I've seen that even amongst adults. Today, if I'm sitting with friends who are in their 40s and I just happen to ask them, how many of you are on multivitamins and regular doses of vitamin D and calcium? And they'll be like, but we eat healthy, we don't need it. But your body needs it, so I think this should really be a separate awareness campaign talking about the importance of these supplements and nutritional elements that are needed even from a growing child or a woman who is then going to get into menopause, and then you have many deficiencies which again lead to other problems. So yeah, I agree with you. In fact, during pregnancy also folic acid is recommended, and I think it's an important part of development.
The next point of discussion can be how the families and caregivers can help these children, and what can be their role in taking care of such children. As you mentioned about the heightened anxiety part and how they should try to cope up. Are there any specific, guidelines, protocols which are followed within the institution and outside the institution?
So, in fact, we launched with the Indian Academy of Pediatrics. We have the guidelines for Fragile X, which were released in 2019, which we always share with the families. Besides that, I have put together a quick guide. Today, I believe that even if I'm buying Samsung phone or an Apple phone for the 10th time in my life, it still comes with a quick guide. It still comes with a QR code for a tutorial. So imagine a child who is neurodiverse, the family is completely lost. I have put together a quick guide of around 6 pages, which is very little text, but a lot of graphics to explain to families what to do. And I tell them, please make copies of it and stick it at least in 2 places in your house. Give it to your therapist, give it to other family members. Now, we tell them things in the quick guide like, don't ask the children direct questions. If I'm going to ask a child a direct question, it's going to increase his anxiety. But there are ways to get answers even without asking a direct question. You ask an indirect question, talk to someone, and this child is automatically going to respond. They are children at the end of the day. And if you use half a sentence, the child is going to complete the sentence. It's just inherited in them. If I ask a child, what did you do in the garden today? But if you ask a child, today when you went to the garden, and he's immediately going to say, sat on the swing. Okay, so this is for verbal children. Of course, for non-verbal children, we have different techniques. So these small techniques which we share with the family is to make your day-to-day living a lot easier. It's for a family who's living with a child with neurodiversities, it's all about attending therapy, going to school, going for the extra, program, special education, another therapy, and then maybe to the garden, a little playtime, and then they have another routine at home. So the children are getting very overwhelmed with everything, and so does the family. It's very important for the family to look after themselves. We have a whole community of around 280 families on WhatsApp who are connected, and we're always supporting each other, encouraging each other. If a child needs help, or if a mother says, okay, today I'm very stressed, something like this happened, everyone will try to soothe the mother. Or today, if they have a victory, like, okay, today my child walked for the first time, everyone is celebrating together. So it's like a large family put together, and everyone's walking the same path. Everyone's walking the same route, because you're all dealing with the same condition. So it becomes a lot easier for the family to cope with their situation.
An additional question to that, I wanted to ask you, ma'am. How the normal children or the other kids can also join hands with them and help them become better? Is there a program which runs across in your society as well?
But today we do have a lot of children who want to make a difference. We have volunteers, and I always say that you make the first step, but try not to ask a question. Now, if a neurotypical child wants to become friends with a neurodiverse child, try not to ask questions like, hey, what's your name? What if that child is nonverbal? He's not going to be able to speak. So your attempt towards friendship is actually going to go the other way. Okay, we actually do training, because sometimes I have college students who will say, ma'am, can you tell us how can we become friends with neurodiverse children and add value? It's all about inclusion. And today, with so much awareness, everyone wants to take 2 steps forward towards inclusion. So we give them small tips, give a compliment. Just giving a high five to a child is a good way to acknowledge the child's presence, rather than turning your face out of fear or out of ignorance. This is something that I think really needs to be talked about a lot more. We need to empower our general public as to how they can take 10 steps forward towards inclusion. You don't have to really move a mountain. Just give someone a smile, give them a high five, give them a compliment. It's a good start towards inclusion.
Those were really, really good tips. Most kids actually keep up, have that tendency to jump into the conclusion or ask the questions directly because they are very direct. And such kids, when I encounter in OPD practice who are neurodiverse or autism spectrum or other kids, I usually tend to avoid that question and try to start with complimenting them. When we vaccinate, that's probably the biggest challenge for me. Because post-vaccination, they might actually feel that, okay, I'm trying to talk with him. Then they might tell them, okay, there was another child who cried a lot and he was even bigger than you. And then they start smiling, and then they keep high five, as you rightly said. I think this generation needs high five every time.
That's so cute. That's really a cute thing to do. And I think you've got it right. You've just inherently got it right. You're doing the right thing. Yeah.
And almost all kids who get vaccinated from me, they end up smiling and giving a high five.
That's a good one.
But grossly speaking, are there any specific steps they should follow?
Most of the developmental pediatricians who see a child with Fragile X or autism, if they think the child is very anxious, they might put them on anti-anxiety medications. Some children may need medication for better attention in school and tasks and activities. If the child is going through epilepsy, they might need to be on anti-epileptic medications, where again awareness is so important, because you cannot stop the medication for 2 years till the child is completely episode free. And there again, having a support group which is reinforcing it, because the doctor saying it is sometimes just not enough. They have to have a support system in place where they understand that your child needs to be free of an episode for 2 years, and let the doctor decide when to start and stop the medicine. The family cannot take that decision themselves. It's very, very important.
And many of the times when they go to some other place for vaccinations, so they are giving live vaccinations and they come up with breakthrough seizures, or they have been given medicines which are not supposed to be given when they have seizures. Some of the anticholinergic or cold medicines, and some of the medicines which are given for deworming. So there are many things, aspects which they are not aware, and I feel it's our duty to probably at least make some basic guidelines and give it as a handout, or put it in their file, saying that okay, this is the first thing you should remember, that because your child, along with Fragile X or autism spectrum, has a seizure disorder, and these are the very basic things you must make sure that doesn't happen. If there's a seizure, what to do, and if you miss your medications, what to do.
And also maybe adding them onto a support group, if you already know of a support group, would make a difference, because then you're speaking to other families who are in the same shoes as you, and that really reinforces what the doctor is saying.
Yes. I think most pediatricians need to actually form such groups and redirect these families to them. Even when they are in a dilemma whether to follow us or not to follow, because when they have been told for the first time your child might be having this, they get really anxious and they start Googling a lot.
And then we counsel them. As a family support group, we counsel them and tell them, the doctor is not benefiting. The doctor is saying it for your child, because every epileptic attack is actually taking your child's milestones behind, and is not healthy for the child's brain. By keeping him epilepsy free, you are helping your child. And then they're worried about the side effects of the medicines, and then they need to remember that getting an epileptic attack is even more damaging than any side effect you can imagine. So, these are things which need to be reiterated to them from a non-doctor for them to really follow. And I think that's one of the big roles we play in telling people about it.
Many times I actually end up telling them that if you ask me whether the benefits of these medicine outweigh the risks, then that is, but whether it's going to help you, yes.
Right.
That part usually, gives them a better perspective, as you rightly mentioned.
Absolutely.
And are there any specific ongoing researches or advancements in India with respect to Fragile X?
Well, globally, I know there are a lot of studies going on, and nothing specifically in India, but of course, it's very easy for us to follow suit with what's going on abroad. I can easily say that today, whether it comes to the regular medications or therapies, India is at par with whatever is happening in the US, because over the last 21 years at Fragile X Society, we have seen to it, we've brought in doctors from abroad, we've gotten a lot of trainings happening here, and every doctor here today is so proactive. They want to learn what's the best for the child. I have families who are Indian and living in the US or living in other countries calling me and saying that, okay, we want to relocate, but will we get the best services in India? Will we get the best medical support and therapeutical support? And I proudly tell them, yes, India is very well equipped and you will get absolutely the same medical support at par. Okay, when it comes to what is happening in terms of research, even if we are not in day-to-day touch with what's happening in research, when it comes to application, we can apply it, right? So that is what ultimately, that is what is impacting your child. Because I know some families who go cuckoo, tapping every new research every single day. They send me articles. Today this happened, this happened, this happened. But please wait till it is applicable to your child. If there is a drug trial going on, okay, even if it's reached phase 3 in the US, when are they applying it on human beings, and when are they seeing the results, and what is the long term impact, and has it become a part of the prescribed medication? If not, I tell the families, stop following such research, because it's taking your time and attention away from what is actually working for your child, because you're still in that hope that, oh, that drug might be a magic drug for my child. So my personal thought process is very different, and I usually tell the families, steer clear from it. Okay, once in 6 months, read up what is the latest research happening, what is the scope of treatment, etc. If there's something that is worth applying and bringing here, we bring it here. Otherwise, wait. You need to wait, because in 21 years, I have seen at least 7 drugs that have reached a high level of trials and then got shelved. What was the point? And I've seen so many families who don't go for therapy, who don't do the treatment that they are given because they're waiting for that drug. Now, you can't do that. You have to see, everyone has a limited set of resources, whether it's time, money, your mental bandwidth, your emotional bandwidth. Do you want to waste it on something that might even happen or not happen? You'd rather invest it in what you know is working. So that is my take on it. Of course, I know researchers abroad are working very hard to try different ways of even turning on the gene, and different ways of how, through Fragile X, they can even help the autism community. But there's nothing very substantial that we can bring into action yet.
So, is there any specific, or are there any specific societies among the government, and there are other societies as well who actually collaborate with your society, and how do they work together to bring this larger picture, and how do they help each other? Yeah, please.
Fragile X Society of India is the only organization in India that is committed to Fragile X syndrome as a condition. We have networking with most of the doctors around the country, and so if there's a child diagnosed in Bihar or in South or in Nagpur, the doctor will normally know about us and connect the family to us. And I always tell the doctors to look at us as an extension of the work you do. Now, if today you made a diagnosis of Fragile X syndrome, I cannot expect you to sit with the family for 2 hours explaining to them what is Fragile X syndrome, how is it affecting the child, what is the implication, what is the way forward. That is the role we take over, where we explain to the families exactly, sometimes in non-medical terminology, in layman's words, how it is impacting the child, what are the do's, what are the don'ts. And suppose someone from the autism community comes across a child with Fragile X, they will always refer them to us. And we don't really have any tie-ups with any communities, but all the doctors and therapists who know about us usually will guide the families to us. Otherwise, by default, if you type Fragile X India, you're guided to us. And I realized 5 years ago that I have repeated what is Fragile X around 30,000 times in my life. And that is why I made a course on Udemy called The Basics of Fragile X Syndrome. And we've nearly reached 1,000 students who've attended the course. So it's a very simple course using the least medical terminology. I've made it basically for families. So today when we have a new family getting attached to us, I tell them that go through the course. You have me talking in it. I'm explaining everything to you. Make all your notes and then come back with all your questions together. So I think that course is also a big savior for many families. We also have a lot of medical webinars, and many medical students attend the course and they think it's a very well curated course. So I think that's the best we could have done.
We can see that you already have a UNIC course and other
Yeah.
things which can help, and which we can actually also redirect such parents to go through that.
Yes, absolutely, absolutely. In fact, I'm just updating it because that course is 5 years old, and now there are more trimmed out things I want to say. So I am updating the course, maybe later.
Misconceptions between in many families who understand about Fragile X or even autism spectrum disorder. So what are the misconceptions? So a brief idea about that, if we can discuss. Misconceptions about Fragile X.
So many people have the misconception that it cannot be inherited, because the first time when you tell them that it is an inherited condition, they will be like, there's no one in my family who has this condition. There's a lot of fear when it comes to the whole taboo of an inherited condition. There's a lot of resistance when we tell them that they might need to test the sibling or the other family members also. Them think autism and Fragile X is the same thing, but they need to understand the difference between the two. Fragile X does come under the larger spectrum disorder of autism, but they need to understand the differences also. So these are a few myths, and of course we are living in India where sometimes they think that doing a particular puja and doing some other things is going to help, and that's why I specifically tell them that those are alternative remedies. You can do it, but not at the cost of your mainstream remedies. Your mainstream treatment cannot get compromised. So there are a lot of these myths, गाय को रोटी नहीं खिलाया when you were pregnant, or did the mother will feel, oh, I went dancing, or I was active, or is it my mistake? So it's very important that we bust, and I think that's key here. So many families come with a lot of guilt. The mothers come with a lot of guilt that I did something wrong in my pregnancy. I think just because the mother carries the child, she thinks it's her mistake that the child has a condition. So it's very important for us to talk them through this and explain to them that no, you did not do anything wrong, and it's an inherited condition which has touched your child.
And it becomes quite difficult to explain to the fathers that they should, or that they should not keep blaming the mother, and also that this is not something which they are supposed to keep on blaming, or it is their fault, or they have forgotten to tell, or whatever. Nobody is aware. As we know that even Fragile X can be a sporadic mutation.
Yeah.
Some of them can be familial, some of them can be sporadic as well. So nobody would have known in the past that there is a possibility.
Yeah.
But it can still happen.
So that is all coming with awareness. It all boils down to awareness. When there is awareness, then what the father is thinking is obviously different from what they read and what they know. So then that takes care of it.
I think it was a very wonderful discussion. And
we would like to really extend our hand to you. If you come across families who need help, please feel free to connect. We would like to be a support.
Privileged to have support from your society.